take a minute and absorb all this. I am completely outside my realm. I should be in the United States. I'm not sure how I ended up in Kenya. So it's actually a pleasure to be here. This is the first time I have been in Kenya, Nairobi. First time in Diani. Apparently, there's a beach somewhere here. I'd like to take a look at that before I head back tomorrow morning. But I want to start off this whole presentation with some questions for all of you. All of you. Just take a minute and have a journey in your head. If there's one thing that you can pick up from this conversation and go home and improve the efficiency of your practice, who will not want to increase their revenue? We're living in the world in the United States, unfortunately, and I'll tell you about the United States for 2 seconds, where our revenues are all going down. Our cost of operations have all gone up. So we're struggling in a different way, and I'm sure you guys have your own challenges in your own ways. There's nobody who lives in a bubble with no challenges. So how many assistants are in this room? No assistants? No dental assistants at all? 1, 2? Anybody else? 3? Okay, we need to improve the overall appearance of the assistants here. You guys are actually, technically speaking, the heart of my failure and my success, and so for everybody's team. So the question is, why? What am I actually doing here? Let me just briefly discuss about myself here. And I'll tell you a story. This is all about a story. And guys, the story is all based on a dream. We have all reached to this point in our life with a dream and working hard to achieve something. Nobody just got here with a cakewalk. So I graduated from Tufts University in Boston. I've been practicing for about 25 years. I own and operate Smiles on Greatwood Dentistry, but I'm also a owner of a DSO. I don't want to go too much detail into it, but DSO in the United States is a larger corporation that has multiple practices. So I have 3 to 4 practices under the DSO. So I have multiple practices that I clinically work from. And we have associates in each of these practices. And then also I have Greatwood Dental Assisting Program. So the story is this. In 25 years, we realized we were constantly having problems in finding training assistants. You train them, they get up and leave for 50 cents across the street. I'm like, come on, you take my time, you play with my equipment, with my IT stuff, and then you go across the street. So it was a constant rollover. And that affected my production. That affected my revenue. It was hitting my pocketbook because I realized to have success, it's not me. I promise you guys, the success is not me. The success is based on a team. And the team consists of a good dental assistant, a good front desk, and a good hygienist. So somebody told me this a long time ago. A success is based on a team. A failure is based on me because I failed as a leader to train you. But the success does not come because of me. It comes from the team. Remember that conversation because I remember this 25 years ago. So what am I doing here? Okay, so let's talk about the GDAP program. I opened the school up with the principle that I'm tired of training people. Why not train them the way I want to train them? Why not guide them with the curriculum? So we said, let's talk about the school and we'll train them so we can get the dental assistants to be trained within our own practices. And now we're at the point where people in Houston are well aware of the program. So they call and they ask, can you please send us dental assistants because we want dental assistants. You guys are in demand. Dental assistant, the 3, 4 of you there, you guys are in demand over there. And I'm sure you're in demand here too. You just don't realize it, how much of a demand you are. You are technically my right-hand person in the office. Without you, I cannot produce. But in order for me to produce and generate revenue, I need you to be well-trained to help me, not be a liability, but be an asset. Do you understand what I'm saying? Which means you have to be confident in yourself, in what you're giving to the doctors to help them move efficiently from room after room after room. So in Smiles on Greatwood Dentistry, I have 5 rooms. I practice out of 5 rooms. So I go from one room to another room to another room to another room. But I am not there doing procedures all day long on just one patient, because I'm gonna just die, literally die. So that is why we created the school, so I could use them. Now, COVID came along, and COVID changed a lot of things for us, good and bad. We were all on books, and then we said, no, this is going to change. We went on the hybrid module. So now we're online program to allow these students to take the classes online during the week, because so a lot of people work during the week and they are unable to come in. So the classes are only on Saturdays, full day, so they can take the classes online. And then when they come on Saturdays, it is all hands-on. That's it, nothing much more than that, simple. I want them to sit down and learn how to take x-rays from day one. I want them to understand the anatomy of the body. You are not taking a straw and putting in the mouth and just sucking the water. No, you're not doing that. You are more than that. You are a healthcare provider. Be proud of it. We are all healthcare providers, and we're all respected. But why is it that during COVID, everybody looked and you said, oh, you're a healthcare provider? Oh, salute you. What happened? Who died? COVID made us become much more in the limelight. So I tell all my students, guys, be proud who you are. Be proud of a team, and be proud that you can go home and say, I understand anatomy. I understand the health, and I can provide more than just suctioning. Be proud of it. So we adopted this model. Okay, I'll come back to this slide later on. This is my school. It's all on hands-on training program. It is all online. So we have the academic portion, which is 40 hours, and didactic is 40 hours. I'm going to come to that. But the point is, we want to build this program so that we can generate assistants who can be efficient for us, who can help us. Briefly, the school is regulated by the Texas Workforce Commission and the licensor. I understand here, and correct me, I've only been here 2.5 days, I'm still learning, that the dental assistants do not have a licensing program at this point. Nothing is there. Am I correct? Somebody say yes, no? Okay. We are regulated by the state board, which means they control me. These guys, I hate. I literally hate them because they're on top of me all the time. They come in and audit my charts every single year, no matter what happens. Like it or not. But the most important thing is we have to go over OSHA, HIPAA. HIPAA is very important for us. And then somebody will ask me what they are, or probably already knows what HIPAA is. HIPAA is patient privacy. So we're a small class size, but we start with radiology from day one. I've put alginate down, but to be honest with you, we teach alginate because they need to know the old ways. But 9 out of 10 times, it's all intraoral scanning. I want them to understand the new technologies that are out there. That is part of a teaching program so that they can go out, either use iTero, they can use Medit, whatever scanning system, they need to know how to use it. Why? I'm selfish, because if somebody wants a night guard, I'm not sitting there scanning it. I'm sorry, I'm too old for this. The assistant can scan, I'll go to the next room. So for example, Kenyan shillings, US dollars may be different. If I charge $400 for a night guard, she generated $400 for me while I was sitting in the next room. But if that assistant's gone, that means I have to come back and scan it. That means I lost production there. So the value of being trained assistants can help you generate revenue quite a bit. Okay? So in this program, it's a 10-Saturday course, but I am also involved as a director. I have 2 instructors, but I am also there. I also come in because I want them to learn this portion. The four-handed dentistry is important. Are you giving me instruments on top of the patient's head? Under the patient's head? What are you doing? They need to know how to pass instruments. Don't just look over there and just pass it to me because you know what, it's going to fall. Then in the States, you cry the wrong way and you got a lawsuit coming your way. I'm sorry, just the way we are living in the world, this is how it works. We also provide them with CPR certification because the CPR is a mandate requirement in order for the licensing to happen. So anybody can help me answer this question. What is the percentage from here to there? How many dental assistants want to become hygienists? Anybody give me just a random number? No idea? Oh, give me a number. Come on, we're in a casino. Come on, give me a number. 60%? Is that Dr. Moore? Don't know? Don't know. Okay. 90% of the population that apply for my program want to become hygienists. Some of them actually want to go become dentists. Some of them have actually come from Mexico across the border because Houston is on the south side, because they want to come in, they want to learn, and then they'll go back, just so they can go back and train their dental assistants. So that's one of our instructors. That's our class size. So we are allowed to take about 12 to 15 because it's not quantity, it is quality. And I'll tell you why we did this. Okay? Now think of this way. I am a dentist, but I'm also a businessman. I also have to look at P&Ls, and I also have to look at operation costs. So I have one office, Smiles on Greatwood, one umbrella, which has fixed expense. But within the fixed expense, I have the school and the office running simultaneously. So I can, and two separate entities. In other words, two separate revenues, so that it can help cover the overhead expense of one location. Plus, I can pick up the cream of the cream crop, or whatever you want to call it, of the assistance for myself first. And then the leftovers, I'll say, okay, take whoever you want. Have a good day. Okay? But there is a requirement of 70% graduation, and we have attendance. We have proper systems and guidelines and rules and regulations we have to follow in order for them to pass. You don't follow those instructions, you don't do your work, and you don't do your homework. Are you kidding me? Really? 5 minutes? Okay. Okay. So it's a 10-week course. I think he gave me 5 extra minutes, the guy at the back. 10 weeks course, which is on Saturdays only, to allow people who work during the week, they can come on Saturdays. Okay? I have instructors who've been with me for a long, long time. One of them actually has a PhD degree. One of them has been in the military and ex-military, and she's been out and she's been helping me with all this. So it's a 40-hour online, 40 hours in lab. These are the things we expect them to do, and I'll go back in more in detail. I want them to learn infection control, sterilization, radiography, digital charting, scheduling. They need to understand OSHA and HIPAA rules. You cannot. This happens even back home. Oh, Mr. Jones, she's being a pain in the, you know what? She doesn't want me to do this. Guys, can you keep your lips quiet? You're breaking every HIPAA rule under the sun. You've got to be careful when you're talking, who you're talking to, and where you're talking to. You can't be in the hallway just discussing willy-nilly. These are guidelines you have to make the assistants understand. Be careful in what you say and where you say and who you say it to. Oh, did I just close it? Or you just cut me off? Wait. All right. Come on, give me at least 5 minutes. So these are requirements, and I'm going to go through all this very quickly because I just want to give you an idea. There are some rules and regulations. These are all our rules and regulations. This is something new that has come up. Human trafficking. We have to have human trafficking course as part of our curriculum in order to get the students to get their license. What I'm trying to basically give you a perspective, these are all the requirements we have to go through. I'm sure every governing body will have their own challenges and rules and regulations that you're going to have to go through. But opening a school is not easy. Running a school is definitely not that easy. But there's value to it, and nothing comes without hardship. These are the things that I expect the dental assistants to be able to do. So this is a slide it's pertaining to you guys. Ask the question, how many of your assistants are able to do this or are willing to do this or are capable of doing this? I do a lot of surgery with bone grafts for bone preservations. I need an assistant who knows how to do it. They should be able to help me with nitrous oxide monitoring. I have to be in the operatory, but they should be able to help me with that. Coronal polishing? I'm not sitting there on a 5-year-old child and doing coronal polishing. No, they're going to do it, and then that's it. Move on. I'll come in and check to make sure. Those are guidelines that we have got approval for. It may not apply in Kenya, or it may. I don't know. Someone can probably pull me on the side later and saying, no, we can't do I don't like you, my friend. But they should know how to do CBCTs. They should be able to help me scan. They should help me with diode laser. I have not used a blade. God knows, it's been over 15 years. If I want to do gingivectomy, I will use this. If I want to see the margins of the crown, I'll use this. But they should know how to get everything set up for me so I can move efficiently. Oh, scanners I've already talked about. So those are the things. Now, this applies to us. I just wanted to give you guys an idea of what the assistants are capable of earning. It may not be there because somebody may want to come there, may want to come and train there. But this is something that what assistants get. Assistants now can get paid over $20 an hour, $25 an hour. That's not chump change. It adds up. You guys can sit down and convert that 128.5 times $20 an hour, and you'll get the answer. So, why am I in Kenya? What are you doing here? Why are you talking to me about all this? And this is where I want to talk to you from a whole different perspective. You've got to give me 5 more minutes, please. I woke up one day and I called my staff, my entire team, and I said, guys, I want to take this school to a global platform. I think the time has come. I want to take this to an international platform. The answer came back was not what I expected. I thought they were going to say, great, doc, we'll help you. The answer came back and they said, what did you have for breakfast? I said, why, you guys have no faith in me? And they all laughed. But that comes with the dream. Everything comes with the dream. And I reached out to multiple institutions, and AKU in Nairobi said, Akbar, why don't you come learn, watch, observe how we do things here. So come under the AKU umbrella and see what you can guide us, because there's a lot of improvement. We do need help in dental assisting. We do want to make sure that our doctors are being trained correctly to the best of their abilities. Keeping in mind, it's an online program. So in lieu of that, we already have a team set up to do online. Okay? I already met with, so you guys have a few schools, if I'm missing anybody. I already met Dr. Simiyu. I don't know if I saw him this morning. This Penn Foster, which is based in the US. I met Tom Ocholo. Sorry, apologies. The only one I have not had a chance to talk to, and I was supposed to meet with him yesterday, was Dr. Bernard Mois. Oh, that's you. Okay, well, I would love to sit down and talk to you about it. And I visited the university as well. So these are some old stats we've been talking about. Okay? The key of the whole conversation is, why is it relevant? Because you guys have some mandates already listed for 2022 to 2030. How to create international platforms, international relationships. How do we get Kenya to the level where we are all speaking similar languages? This is pulled from your stats. Okay? What are we trying to do here? We're trying to create an environment of alliance, relationships, understanding. Can we come in? Can we help through the AKU process of creating some relationships? Doc, you just mentioned in your speech, and I was sitting there, everything comes from relationships. Am I correct? Partnerships, opportunities. And I know he's one of the most senior doctors here, very well respected. Am I correct? Yes? Okay. So it's all about how to help each other. And guys, I am not sitting in Houston telling you my office runs hunky-dory. We also have similar problems. But the problem is, as long as we can train these people to be an asset, not a liability, as long as we create the value in these assistants, give them some parameters of guiding them, when they come out of these schools, if they have some hands-on experience, you can build from there. It will help you to generate more revenue. It will help you to be more efficient from one room to another room to another room. And there's a curriculum we have. And unfortunately, I could not put the curriculum because I didn't have the time frame. I was told it's only 20 minutes or you'll be kicked out. So I'm happy to have that conversation saying there's a proper system of checks and balances. There are exams that we go through. This is all the way the office works, the school works. Now look at these systems we teach in every module. There are 10 modules, right? These are the 5 modules. There's a midterm exam. And there's a final exam. And this final exam actually goes to the state board. So this is regulated with them. But these are the things that we have to teach them. And why? This is the part I like the most. Can you guys all, doctors who have your own practices, identify one individual in your private practices who can be cross-trained and given the opportunity to be front and back? Because in the States, this is what we want them to learn. I never put any of my assistants to be only at the back. They should be able to be cross-trained. Pick up the phone, how to speak, how to welcome them, because how you communicate is also equally important. You can cut costs down. We're teaching these assistants now AI. We're teaching these assistants how to help take pictures so that the digital x-rays can also help through the AI program for diagnosis. They are not diagnosing, they're doing it in a way so they're getting exposure to the AI. The world is all going towards the AI. We have AI programs now that we're teaching the assistants to understand how insurance verifications can be done automatically. Why? Because we realized dental assistants were coming in late. Tardiness, no concept of or human error. I'm not doing a crown prep just to find out that the insurance is not going to pay for it. So we're creating AIs, but we're teaching the dental assistants how to do AI. So giving them roles and responsibilities to do better in life and be more well-rounded so they can be used in multiple places in the private practice arena. So they are cross-training. Keep the cost down. Help you when the patients are busy, you work at the back, but when patients' office is slowing down, bring them to the front. Don't send them home. You can use them in multiple ways because they should be trained that way. Okay? So all this is done. These are all my assistants and students. These are all live pictures that I've taken from. But we don't work on mannequins. I don't have a mannequin in my office, or I do if it's sitting in the drawer. I want them to learn on each other because they could have tori, they could have gag reflex, they could have Christmas, they could have limited opening. All these are real life challenges that patients go through. I know you guys are very much about rubber dam. Well, we don't like using rubber dams. I need my assistants to be able to move quickly and isolate so I can get a filling done and move to the next one. Because the assistants take too long to put rubber dam on. And they're not happy doing it. But that's not a technique we teach. Yeah, unless you're doing endo, that's a different conversation. But on day-to-day operations, no. Oh, they kicked me out, all right. Questions? Any questions?
Sorry to interrupt you.
That's okay.
It's just the time that we're working with. We would love to hear more from you.
Sure.
And in case anyone has a question, because of the time constraint, maybe they can follow back to you after the session is done.
Absolutely.
Right?
Okay.
Yes.
All right.
So
thank you guys
so much.
Thank you.